have a footprint or had not had a footprint in West Africa ever. When the Ebola crisis struck, we felt that both based on our solidarity and proximity to a lot of these grassroots organizations and at the behest of the governments of the countries of Sierra Leone and Liberia particularly, as well as from international organizations, particularly the World Bank, which is headed by one of the founders of Partners in Health, Jim Kim. We really felt that we had to do something as Partners in Health. And so we had not started a new project since 2008, when we started our teeny project in Kazakhstan. 2007, Malawi, 6, Lesotho, 5, Rwanda. It had been a while since we had a kind of an expansion of the Partners Health footprint, and we had kind of made a decision that a lot of our expansion would be to help you guys, to help like-minded groups around the world rather than direct engagement of Partners in Health. But I think Ebola really changed that for us. So what we found at Partners in Health over the years is we can't say we don't do disaster. We can say that's not our sort of main frontline thing, but if we are working in countries where disasters strike and we see this intersection, we're going to be sort of compelled to act. And that's the story of how we have gotten engaged in Ebola. What we're trying to do is a couple of things. One is to really have very clear protocols for returning travelers. The clear protocols are to do a couple of things. One is to make sure everyone is safe, so that you can come to work with confidence that the person sitting in the desk next to you is not infectious, otherwise they wouldn't be there, right? We want to give you that confidence.
So if you look at the middle category, the some risk exposure, so that is healthcare workers. So this is people who have not had a known high risk exposure. So you haven't had a needle stick, you haven't directly had someone vomit onto your weakest memories, and you don't have an incident that you know you were directly exposed. For anyone who is at a certain level of risk, doing patient care, dealing with burials, cleaning up Ebola treatment units, there will be a daily in-person check-in with a team nurse. So taking temperature, checking about symptoms, reminding people that anytime they have any concern about any symptom they may or may not have, they need to, 24 hours a day, go to the designated person in the team with them. And
that first few days, you are not particularly infectious. Your risk to others in that period is nearly zero, according to Tony Fauci. And we agree with that, because if you look at viral replication and the excretion of virus, very, very little.
We are going to have travelers, especially these clinical short-term people, coming back to many parts of the U.S. and some people, like our Brigham doctors here, might be required to do their own occupational health screening. So that with their institution. So you've got CDC, you've got your institution, and you've got PIH. So in the case that there is an institution like the Brigham that is doing someone's screening when they come back, like let's say I'm a Brigham employee, right? So let's say I'll come back. I will do my 21 days of emails with the Brigham OcHealth, but then they'll be telling our OcHealth person and giving us feedback. So you wouldn't have to do it with PIH and your hospital and the CDC.